Hi, class. My name is Christina. Today I will be discussing muscular dystrophy. It is a group of genetic conditions that primarily affect muscles, leading to weakness and muscle loss mass over time. Muscular dystrophy is a group of genetic disorders caused by mutations in genes responsible for muscle structure and function. These mutations lead to progressive weakness and muscle degeneration. Depending on the type, it can be inherited in an X-linked or autosomal dominant and autosomal recessive. It could either be genetic or spontaneous. There are many types of muscular dystrophy. Duchenne, MD or muscular dystrophy, and Becker are the most common. Um, there's also myotonic, limb-girdle. I will mostly be focusing on the Duchenne and Becker. Uh, Duchenne and Becker muscular dystrophy, the gene affected is called dystrophin gene. Um, and so in this mutation, it's either a small mutation, which wouldn't have that many, it wouldn't be that severe. And then there's the deletion of the mutation and a duplication of the mutation, as you can see in this picture. Here are some examples of muscular dystrophies and how they are inherited. Duchenne and Becker are X-linked. Most of the people who are affected are males because it is X-linked. Um, Myotonic dystrophy is autosomal dominant, and only one of the genes needs to be mutated. In autosomal recessive, both copies of the gene must be mutated for the disease to be developed. Um, Here are the demographics. 1 in 5 to 10,000 individuals is affected by muscular dystrophy. It is mostly prevalent in males, um, and it is diagnosed usually in childhood, although it can manifest in later on in life. Life expectancy with people with MD varies. Uh, Before, I think people lived to their teens, but now they are living, well, some are living to their 50s with help of physical therapy, medication, gene therapy. Um, Here's a graph showing on the B side, you can see how people before the 1970s, which is the blue line, the most or the oldest they would get is in their 30s. But after the 1990s, they are stretching out and living past their 40s. Muscular dystrophy affects many organ systems. The main one, or the most common, like visually seen, is the muscular system. Progression in muscle weakness, degeneration. Because they are weak in the muscles, their posture becomes more, you know, abnormal, kind of like scoliosis in some types. Uh, Respiratory system is affected, weakness in the diaphragm, intercostal muscles that help breathing, and with Duchenne muscular dystrophy, even the cardiovascular system is affected. The picture on the right shows the different muscle groups that different types of MD affects. Or if I said it backwards, huh? So with Duchenne, you can see that a lot of the muscle groups are affected. Distal MD, the distal part of the arms and the distal part of the legs are affected, and so forth. You can see the different types of muscles groups that are affected with different MDs. Um, Different muscle tissues start to degenerate, and connective tissues become more involved in the following ways. You can see the picture. A is normal muscle tissue, and then B is someone with muscular dystrophy. Muscles are damaged, and the body starts to replace it with muscle fibers connective tissue, which contribute to the stiffness of the muscle. Uh, the formation of or overproduction of collagen also leads to excessive scar tissue information, and adipose tissue starts replacing like those empty gaps that are left as the muscle starts to degenerate. Signs and symptoms, a lot of parents start to see delayed growth and motor milestones, their kids walking on toes, large calf muscles. The large calf muscles are because uh, since the muscle starts to degenerate, the adipose tissue starts to replace those areas, so they get like really big. Um, Poor balance, like an awkward stance. The belly sticks out. You can see in this picture, um, right here. Frequent falls. Diagnosing muscular dystrophy can take months to years to diagnose. Mostly blood tests to check enzymes, muscle biopsies to determine what kind of muscular dystrophy, electromyography to measure the muscle and electrical activity. There is no cure for muscular dystrophy, although there are many treatments to slow down the progression, and there are looking into ways to reverse some of the symptoms. Physical therapy um, does help patients, occupational therapy, respiratory therapy is important to maintain breathing function. Um, Medications like corticosteroids have helped a lot to slow down the progression. Um, Many people with MD use assistive devices like wheelchairs or muscle or like leg braces. The use of AI is increasingly being used to diagnose and treat muscular dystrophy. Uh, AI is being used with MRIs to detect muscle degeneration earlier with more precision, and machine learning is applied to the muscle MRI data. And tools like these are being developed to perform drug screening and accelerate identification. So, to wrap this up, muscular dystrophy is a life-changing condition that affects people differently, but with early intervention and supportive care, individuals can still live fulfilling lives. Awareness and continued research are crucial for the betterment, treatment of, and hopefully cure the disease. Thank you. Here are my references.